if we blow up the entire healthcare system, first of all, Zane and Jared, I'll call you first. But realistically, we can't just burn it down. We have to work within the system because people need care now. So the solutions that are going to win and the best things we can do for that consumer patient are to utilize things that work today within the existing workflows, within existing systems. So if my patients use WhatsApp, let's figure out a way to use WhatsApp for their care. Whatever it is that they think is going to be the most effective for them, we should be digging there and going to where the patients are.
Try to fix the current system or reimagine something new? Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the changes permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about how consumer health works. We spotlight how healthcare is being designed, marketed, and delivered from the consumer point of view, and profile leaders who are championing the move to preventive care. If you want to understand both healthcare as a builder or operator and as a consumer yourself, this is the place for you. Here's what's going down today. First up, I recap the June Think Tank chat, where the RAP community discussed the ongoing move to preventive health, led by wearables, AI tools, GLP-1 medications, and health intelligence platforms. If you're checking out this show, you'll enjoy these monthly open-ended forums where everyone has a voice. So do yourself a favor and sign up at healthcarerapcommunity.com. It's all free, and if you can't attend, still join the community and you'll receive the recap straight to your inbox. That's healthcarerapcommunity.com. After that recap, Zane and I are joined by Dr. Sarah Matt, who talks about themes from her book, The Borderless Healthcare Revolution, what consumer-centered means from a consumer and surgeon's point of view, and why we can't burn down the system even when we see so many flaws. I'm Jared Johnson. Let's get it.
Flavor of the week.
The RAP community hosts monthly think tank chats, which are highly interactive conversations, and everyone has a voice there. Our June think tank covered a lot of ground as we discussed the accelerating shift toward prevention, driven by wearables, AI tools, GLP-1 medications, and health intelligence platforms. We talked about 4 major themes and insights. First, physicians are vocal on experience again. Clinicians are citing experience as a differentiator, with 75 to 80% of that focus on access and the remainder on between visit care and financial toxicity. We also talked about patients bypassing the system. Consumers are increasingly inventing workarounds, using AI chatbots, wearables, and direct-to-consumer apps because the existing system is broken enough that we're tired of waiting. AI usage is outpacing stated trust. Only 4% roughly of Americans strongly trust AI for clinical data, yet behavioral use is significantly higher. So that low percentage are the ones who say that they trust AI for data, but about 1 in 3 U.S. adults have used an AI chatbot for a health-related question at least once. And health intelligence platforms are converging. We talked about how Samsung, Google Health, Aura, and major LLMs with their healthcare versions are all competing to become the central hub for personal health data and recommendations, with an implicit part of that patients need to see their doctor less often. We talked about 5 key topics in addition to those key themes. We talked about GLP-1 fragmentation, about how health systems are handling GLP-1s inconsistently, especially when related to bariatric surgery, medical weight loss, and primary care, with each silo operating independently and no coordinated patient pathway most of the time. We talked about how wearables are maturing. The Oura Ring 5 has launched. The Google Fitbit Air was announced. It's being positioned as the Whoop killer. And the FDA dropped its warning letter against Whoop's blood pressure monitoring feature. We also talked about between visit care and the gap there, where multiple providers were raising the question, what are we doing between appointments? And yet not having a lot of answers for that. We talked about the employer as an entry point, how functional and integrative medicine providers in particular, such as Root Functional Medicine, are going direct to employer and bypassing traditional health system channels. And we also talked about the rural health and health IT momentum that we're seeing. Part of that's related to the $50 billion Rural Health Transformation Fund, which is in the process of distributing its first-year awards state by state. And we also covered the CMS health tech ecosystem and its progression in its initiatives toward a single national provider directory and their Medicare app library. Join our next think tank on July 24th at 11 a.m. Pacific or 2 p.m. Eastern. Visit healthcarerapcommunity.com to RSVP. We look forward to seeing you there. All right, everyone, let's get into the flow. Hey, Zane, you are traveling lately. How are things been?
Things are good. I'm actually in Toronto right now, just visiting some family. So it's been a while since I've been up here. So really cool. Been walking around downtown, went down to the Eaton Center. Actually discovered there's a new primary care concept going in here in Ontario that we might have to bring to our audience and talk about. I couldn't exactly tell, but things are good. Can't complain right now.
Very nice. Well, yes, let's follow up on that. We'll put a footnote to that, the primary care. But our guest today is Dr. Sarah Matt, and I was super happy that you introduced us and connected us. I'd love to hear what you hope to hear out of this conversation.
I was privileged to meet Dr. Sarah Matt, and she'll introduce herself here in a second, at ACHE, so the American College of Healthcare Executive Congress. DexCare, who we've interviewed on this podcast before, it brought us all together for dinner. Myself, Crystal Broy, for our listeners from MUSC, was there, and that whole tribe of people. And Dr. Matt, we had a fantastic dinner, and then she gave me a copy of her new book, The Borderless Healthcare Revolution, that I actually started reading. And so, I don't know, there's a lot of stuff in here. And so, yeah, probably the top thing that I'd be interested in is I really like your definition of access, which we'll get into, I'm sure, here in a second. But I think that's where I would start on things that I would love to hear about. And then also the stories that are in this book, the real life stories of patients and the challenges they face, and then the potential solutions that are being brought to the table, I think will be wonderful for our audience to hear. So a whole laundry list of things that I'm excited to hear about.
Well, perfect time for us to officially welcome Sarah to the program. And thanks for joining us today.
Of course. Thanks for having me. After meeting Zane a couple weeks ago, I'm on board. Let's do this.
Awesome.
Right on. Want to give us a little bit of an intro about yourself, who you are, what you do, and then we'll dive into some things around the book.
Sure. So I'm a surgeon by training. My fellowship's in burns, but I actually moved into the tech sector very early in my career. So I've spent decades doing product development and strategy all over the place. So bunch of mid-sized places like Next Gen Healthcare, cutting my teeth in critical access, and then several startups with some fun exits, everything from pre-hospital to remote robotic surgery. And then I was also at Oracle for a long time, building out their cloud for healthcare and life sciences around the world, and then helping them acquire Cerner. So this past year, I took a break to launch my book, which is The Borderless Healthcare Revolution, which, Zane, you got to finish that book. I can't wait to hear more. But these days, I do a lot of speaking around my book. I'm really passionate about healthcare access, but I also do quite a bit of fractional chief strategy officer work for early stage startups and consulting.
It's fantastic. I think, Jared and I and, our own profiles, maybe we're more tech and consumer experience oriented, but neither of us have a clinical skill. And so it's wonderful to have someone that also brings that to this lens so that you can look at some of the ideas that we might be proposing, say, well, I ain't going to work because of this. And so really appreciate sort of that duality to who you are and what you bring to the table.
Thank you. I think that it's really the secret sauce because, when I went from developing at the application layer at, say, NextGen, and then working down into the platform layer at ESO, and then building out OCI for healthcare and life sciences down to the infrastructure, I think once you can understand the full stack properly and all the different opportunities you have to impact healthcare and life sciences, plus that clinical side, all of a sudden doors open in that you can really make an impact for patients. So I think that's where I really like to be, right there at the intersection.
Yeah, I just think that this whole premise is a great setup for us for our conversation today. Just the premise of healthcare not being broken because of technology, it's broken because of the people building it and the people delivering care aren't aligned, which I think sets us up for a better line of solution delivery overall. But maybe that's a good place for us to start in terms of like where you see that disconnect showing up. Like, where is it most painful at the bedside, for instance? Like, where do you see it showing up?
So when we think about where the technology of healthcare is disconnected from the practice of healthcare, I think that nothing is more illustrative than the most ridiculous part of health tech, the patient portal. So when you think about a patient, you probably have 4 portals from 4 different places. And if you're a caregiver, you have stuff for your kids, you have stuff for your parents, and nobody likes their portal because it doesn't actually serve the needs of what you need it to do. Patient portals were brought into play during meaningful use as a way to check boxes for the incentive programs that help people get digital. And so when we think about why many technologies have been brought to bear, a lot of it was because of regulatory, not because it was actually doing patient engagement, not because it was actually solving a problem. And so I think the disconnect is really the why. And so the good thing, though, is that means it's a design problem. We can fix design problems as we move forward.
I love that. I love that. I love it. There's been a few people we've interviewed on this podcast where their message is not that one of dystopia, but hope. And I can hear that already in your voice, that there's a way through this. And even though things might not be perfect yet, there's a way to get there by following different principles. And, we've certainly had a number of folks on here talking about human-centered design and its importance in health systems. I'm curious, Sarah, as I started reading your book, your first big chapter introduces the concept of access, which, for a lot of people listening, they hear the term access all the time and might roll their eyes and say, hey, I already know all about that. But as I read through your chapter, I would say it was a fantastic refresher to re-anchor what do we really mean by access. And I love the framework that you proposed. I was wondering if you could talk to our audience around how you're thinking about access, how you present it in the book, and what that really means to consumers.
Of course. So I think a lot of people assume access is really about geography. There's huge strain right now in our rural health systems in particular. People see that like, oh, well, it's because they're far away, right? But when we think about access, I like to break it down a little bit differently. I choose 5 different pillars. So geography, of course, but then financial, trust and knowledge, cultural, and digital. And so if we think about those access pillars and kind of take that framework and apply it to almost any healthcare problem, it's usually because one of those pillars is totally messed up. And the biggest thing I see around delivery systems attacking those pillars is that they'll usually choose 1 or 2, but they're not looking at all of them. And so oftentimes the solutions they put in place to fix problems aren't 100% successful because they haven't really considered the whole ecosystem and all the pillars of healthcare access.
Can you say more? So I feel like the trust and knowledge piece might be one that might sound a little bit new to folks that would listen to this podcast. Can you say more about that specific one and why it's so important?
Of course. So healthcare has become very polarizing. I don't know when healthcare was not polarizing, but it must have been before my time. But, there's a lot that's gone on over the last 5 or 10 years here, especially with the pandemic, with all the different pieces, and with the explosion in technology. Doctors and nurses aren't necessarily the most, trusted pinnacles of society anymore. Instead, people push back really hard. And it's not because we don't know what we're doing. It's because they have lots of reasons not to trust the system in general. So we have populations that in the United States in particular, we've historically treated extremely poorly from a healthcare perspective. There's so many areas where transparency, whether it's in pricing or in scheduling or in you name it, is very murky. And so when you're a patient, people have a problem trusting what's going to happen next. And it's because they've been burned before. And so right now, when we think about that trust and knowledge piece, there's definitely a health literacy portion of it about understanding, but also we have good reasons not to trust the system right now. And so I think we have to remember that when we come to patients with a diagnosis, with a solution, with that darn portal token, they're not going to say, let's do it without a lot of questions because they've been burned before.
I think that's fair. I know, when I think of my healthcare experiences, not that thank God I haven't been terribly sick or had anything major happen to me, but I just started to notice, like, even for the healthcare provider that I use, using their portal, I just don't always feel like they're thinking about, call it like my whole self and like guiding me through the process. I feel like I'm constantly asking questions, and then sometimes my PCP gets annoyed. And now that I've been doing my own research, Sarah, and would love to ask you as a physician what you think using tools like ChatGPT, where actually come with pretty decent like evidence and ideas and concepts for what actually might be wrong with me. It's created this weird tension now between the patient and my provider. And so curious what you think of all that as well.
So it's interesting now that more patients have access to these tools. And what I'd say is it's even more interesting that most of the providers caring for those patients actually aren't allowed to use those same tools in practice. And so what we're seeing is this big disconnect between what tools are allowed in an enterprise setting, what evidence it can give, and what providers are not just allowed to share, but are encouraged to share from a transparency perspective with their patients. And then on the other side, we have a now more educated consumer health patient. But at the same time, those disparities are still, very large. But some of the barriers there are decreasing. And what I'd say is that back in the day, my mother had this giant book from 19 who knows what, the big blue book of healthcare. And every time we went to an
Sure.
appointment or
Yeah.
grandma needed X, Y, or Z, she would flip over the book. I literally just asked her the other day if she could dig up that book, and I think she found it. I cannot wait to see that thing. And then we had the Dr. Google era. Okay, great. Now, as a provider, when your patient comes to you with a laundry list, it's difficult. But it's because the system is not supporting providers to take the time to be able to look at that whole list. They literally have 8 to 12 minutes tops to see a patient, write the note, do all their clinical decision making. So while it's exciting to have a more educated patient base that wants to aim you in the right direction, you still have to go through all those pieces. Because like Dr. Google probably didn't go to medical school, Dr. ChatGPT also didn't. And while half the time they're going to be giving you really interesting stuff, they don't have a medical license. And if I get it wrong, it's going down on me. And so I see where the providers are having a hard time because they're not allowed to use some of the tools. Some of the tools are going to have problems because people have problems too. But if it's on your license and your entire career is based on that, it's going to be hard to just say, oh, yeah, let's do that.
I think that's, sage counsel for people to think about, this notion of risk. To your point, like it's on their license. I think sometimes as consumers, we forget that. And so we get frustrated when we come with our own ideas or, hey, I think I need this. But to your point, the physician needs to do their diligence or they're going to get in trouble. And then the other big piece that I don't think the public at large is aware of is just how busy, particularly primary care physicians are. To your point, it's less than 10 minutes, a patient. And to your point, there's just no time. And so I think some of those things haven't yet been communicated or understood by the public. And it's, again, contributes to this friction. Like, why isn't my provider listening to me? Or why doesn't he have time to go over the 10 pages of research I already sent, right? So I think there's some opportunity there around expectations to be set.
I would agree. I would absolutely agree with that.
Well, curious then diving into, and again, I haven't finished the book. And so you need to hold me to it to finish the whole darn thing. But
Oh, I will.
Sarah, as you think about the technology components of what you're suggesting, what might the future look like? And maybe a side question to what I just asked is, could you tell us some stories of patients and examples that you share in your book that kind of highlight where the future could go or technology in a more consumer-centered or, dare I say, borderless healthcare environment could really serve the community?
So first, people ask me all the time, what's going to happen in the next 10 years? And honestly, I can't predict that far in the future anymore. I think when we consider what was
Right.
happening 6 months ago or 12 months ago, the technology is really going forward at such an exponential pace. I think we're going to be looking at models and opportunities that we probably can't even think about right now. And so first, as a patient, as a consumer patient, and as a provider or a health system executive, we have to be open to what that might look like, because what might seem completely preposterous today may actually be very reasonable in a year. So I think first, educating yourself as much as you can, understanding what the possibilities are, and then remaining open to those possibilities, very important. When I think about the stories from my book, I've practiced medicine for a long time. I started out in surgery, my fellowships in burns, and then as I made my transition into tech, I've always seen patients. And so I've been in practices that are Medicare house call practices. I've been in urgent cares and occupational medicine places, and I still do charity internal medicine here in rural upstate New York. And what I'd say is that many of these populations, they don't have any technology. And a lot of the practices that I've been a part of are taking care of these safety net organizational issues. So you're the last resort. One of the things that I get to do today is I get to practice on paper. And you're like, Sarah, are you anti-technology? No, I'm not. It's just my practice as paper because it's the cheapest thing to do in a safety net. So, what I'd say is that I see patients all the time who may not use technology at all. I have a huge Mennonite and Amish population that sees me in my clinic because we're the last
Yep.
resort. I have a
Yep.
huge group of migrant
Yep.
workers and migrant farm workers that I see in my clinic, and they have a variety of different technological issues and opportunities. So if I was to send them the darn token, because I love to beat on that patient portal, they're not going to use it. And so I
Sure.
think
Sure.
one of the biggest things
Right.
is recognizing where your actual patients are at. So for my Mennonite population, we have to call the guy at the end of their street to write them a note, and they'll pick it up next week. And that's how you do it. And that's how we know how to communicate with them. And if you call my phone, someone better be dead because I'm not going to answer my phone. And you got to understand that from me as a patient, right? So I think that when it comes to the stories of these patients, people tend to put people in big groups and don't understand that even the three of us probably expect different things from our healthcare system, want to be communicated with differently in our system. And depending on who we're seeing and what systems they're using, we may or may not get the engagement that we need to be our best selves and to engage with the healthcare system best.
I love that. Couple things stand out. One, I also grew up in a Mennonite community, so I know that population pretty well and worked in rural care. And so I knew the ins and out challenges of serving some of those folks. The other thing that comes to mind as you're speaking is it makes me realize that so many of us in like the innovation digital health space, if we're honest and really thought about it, we're often proposing ideas for like people that live more in like an urban setting that have disposable income, that have like a decently nice house, like especially when I hear a lot of like, why can't we just bring things to people's home? I think people don't realize like some people don't even live in a home like you and I where you can even walk around, right? Like who knows,
Exactly.
especially in like more marginalized populations and like lower income, like home isn't particularly a nice place sometimes, right? And there's low resources there too. And so I think that lack of thinking and in consulting world, you'd probably say customer segmentation is direly missing in our industry and it needs to be thought about a lot more, in my opinion.
So as a builder for my entire career, I think that it really goes back to basic product management principles. A lot of times we end up building for buyers and building for us because we're the builders, as opposed to really understanding the users of our systems and their real pain points. Because there's nothing worse than saying, oh, yeah, everyone's going to have the latest iPhone and. I mean, here we are, we're on this conversation,
Good
and one of
internet.
us already had an internet issue, right? Yeah, exactly. So I think that from a design principle perspective, if we can design for the lowest common denominator, it means that everyone else is actually going to have an amazing experience. But we tend to do the opposite and design for the top of the food chain instead, and then we leave a lot of people behind.
Yep. Yep. Um, maybe very quick, just an anecdote. I'll never forget to applying technology to like inappropriate, call it use cases and not thinking it through. And so when I worked in rural care, accidentally, we thought we were being novel by connecting a behavioral health patient to a telemedicine service in this rural community. Great idea, right? Till we realized after we put him in front of the cart with the camera and the TV is that his chief complaint was that the government was watching him, right? And so putting him in front of a camera with the TV, like freaked him right out. And so again, like it kind of speaks to what you just said, like not really understanding your consumer, your patient, your customer, and where sometimes these technologies just don't work. So just wanted to throw that out there.
So my favorite analogy is that on
Yeah.
Sesame Street, there's this plant, and this plant, it's his birthday, and everyone keeps giving him gifts. And the gifts are like a guitar, a bicycle, and the plant can't actually use a bicycle, or he can't use a guitar. He has no arms. And so when we think about the plant, instead of giving gifts you think you want, I think we should probably figure out if maybe the plant wants sunlight and water. Maybe we should ask.
That is so good. Sarah, I'd love to just kind of use this platform as a chance for our audience to hear even more directly from you, especially our clinical leaders who are listening. If there's if we had to whittle this down and just say, we recognize there's a big distance between current state and the desirable future state. So what's one of those steps? Like what's one move that clinical leaders could make, not today or tomorrow, but in the next year to make healthcare more consumer centered? What's a direction that you're seeing that is working, that can make sense, and that's doable, that can actually, we can see some progress about?
So, from a boots on the ground perspective, something everyone can do no matter where they are in the system is work on that trust pillar. So, whether that's taking an extra minute to explain something to someone who doesn't understand it, or utilizing the right language to a patient, or by asking questions instead of making assumptions, I think that building trust in healthcare is vitally important, and therefore everyone can work on that. When I think about moving forward in the future, something that you can do midterm is really problem definition. We're all very quick to move towards enacting a solution. Oh, we're going to use this amazing AI. Oh, I saw it at HIMSS. It's great. But we forget to actually define the problem. So what I'd say is that the biggest thing you can do for your organization, whether you're in a tech company, whether you're at a delivery system, is define the problems, then determine how you could solve them. And sometimes not so sexy solutions actually work really well.
I love the whole thought of that being a trust pillar and a focus and a step that's very doable to get there, to define those problems, because we tend to get caught in the space in between. It's so easy to feel kind of caught on both ends. It's so easy to feel like we know the current state, hey, I didn't build the current state, I didn't build the system. So, don't blame me, but also I have to live within it. But also I know it's not the best either, but I can't solve it all myself. Like it's, you get hit from all sides, and it's so easy to just kind of feel like, well, okay, now what? So I appreciate that, like just being kind of a first step and a direction for us, because that's how we're going to make progress is one step at a time.
Agreed. And, if we blow up the entire healthcare system, first of all, Zane and Jared, I'll call you first. But realistically, we can't just burn it down. We have to work within the system because people need care now. So the solutions that are going to win and the best things we can do for that consumer patient are to utilize things that work today within the existing workflows, within existing systems. So if my patients use WhatsApp, let's figure out a way to use WhatsApp for their care. Whatever it is that they think is going to be the most effective for them, we should be digging there and going to where the patients are.
I think we're going to have a lot of touch points in the future to be able to point to progress in the industry, things that you're seeing and things that we're recognizing are making a difference in this space. So thanks so much for joining us today, and thanks for everything you're doing to make healthcare consumer-centered and help bring together all these things.
Absolutely. And Zane, I'm waiting for you to finish that book because we're getting back on here so I can actually hear what you think about it.